I'm Doug Johnston. I am the Chief of Cardiac Surgery here at Northwestern Medicine and the Surgical Director of the Bluhm Cardiovascular Institute. So we had 32% growth in our cardiac surgery practice last year, which is a pretty unusual number for a clinical practice. And I think that there are a number of factors that go into this growth. The most important is that we've attracted an incredibly talented group of surgeons who represent really all of the best of modern cardiac surgery. There is not a procedure that is done in cardiac surgery that we don't do here at Northwestern. We've been successful at setting up our surgical robotics program, and we treat a number of conditions that most places don't treat. We've also tried to make it easy for patients to get in the door. I think that growth and access for patients go hand in hand. We are increasingly becoming a destination nationally and internationally for patients who are traveling selectively for care. I think that an integrated health system approach is the future of healthcare. It is increasingly a differentiator for a place like Northwestern, where we want to be sure that geographically, no matter where you are, who you are, you're getting the same care. We can't do this without good information systems, and one of the differentiators here is that we have the same EMR and radiology PACS system at all our hospitals. Also, our communication is fairly seamless. We can get in touch with the right person very quickly. To me, that's what integrated is. It comes down to people supported by the right infrastructure. There is some special sauce, I think, here at Northwestern that is a little bit difficult to duplicate. We have a great footprint across Greater Chicago, and this is a pretty unique practice environment. We've made it easy for patients to get early opinions. We are leveraging telehealth to a great extent, and we have a team of nurse coordinators that are truly experts that will gather all the records, all the imaging for us to review so we can provide a meaningful opinion. But we've really leveraged a health network and a capability of diagnostics and therapeutics, which is pretty unique. There's a very entrepreneurial culture here. We are looking to grow, we're looking to get better, and so we want to attract providers who are innovative, who want to deliver care in unique ways, who bring new procedures, new practices, and people will come here because we allow them to flourish in those roles. It's what allowed us to hire 6 surgeons in the last year, which is a pretty rapid growth. We've hired some amazing cardiologists, but that's really true across the system as a whole. I think patients are attracted to talent. They want to see the best doctors. They want to be taken care of by the best nurses. It's not the buildings, although our physical plant is pretty nice, but the reason people will travel here across many states is because the experience of interacting with top talent. And I think those two things go together. Patients come for the doctors come for the patients.
Premium